This is one presentation which I delivered on 6th of November 2022 at Varanasi at the inauguration CME of Netroday Hospital as being conducted and established by Dr. Abhishek Chandra, and the topic is block the block. Now the block here means the retrobulbar, the peribulbar injection anesthesia which we give to our patients for various eye procedures, and this is the purpose is to promote our topical anesthesia. Now what are the options for anesthesia for ophthalmology procedures? And we are all aware that one of them is local anesthesia, which is delivered using a syringe and a needle which is given in the orbit to neutralize the ciliary ganglion and the nerve supply of the eye so as to make the procedure painless. The other option is topical anesthesia, in which there is no injection given and there just eye drops are instilled to surface of the conjunctiva, which can provide adequate anesthesia for selected ophthalmic procedures. And then we have general anesthesia, which is needed for those surgeries where the nerve supply cannot be neutralized using topical and local anesthesia, and on those patients who are not cooperative and they don't understand the instructions, so that we can have freedom to operate. And out of all these options, I find that topical anesthesia has all the properties one can desire out of any anesthetic agent and technique. So there is no pain on delivery, there is no fear of injection near the eye, it is safe, it facilitates surgery as there is no IOP rise, it is excellent and immediate functional recovery because the motor and sensory nerves which are needed for visual functions are not affected. There is no eye patch needed after surgery, and that makes the procedure a memorable experience for the patient. And this I can vouch by listening to my patients' uh, testimony that they could see the things without any problem immediately after the procedure. So the procedures which are routinely done under topical anesthesia. Topical anesthesia is not nothing new in a sense that we already use it for so many things in our daily routine practice, and there are few of the procedures which I am mentioning are LASIK, the DMAC corneal transplant surgery. So the corneal refractive procedures are all done under topical anesthesia. The contact lenses used for therapeutic and diagnostic uses are used under topical anesthesia. The pterygium excision along with autograft is routinely done under topical anesthesia. The subconjunctival and subtenon injections are given under topical anesthesia, and small biopsies of small lesions on the conjunctival surface are done under topical anesthesia. So what are we talking now? So here this is one surgery which needs mention, although it is one of the flagship surgeries which are done under topical anesthesia, and that is why it simply represents a leader in the use of topical anesthesia in ophthalmology. And Phaco is a choice because none of the ocular functions are compromised because of this anesthesia technique when compared to injection anesthesia. The visual gain is also significant and immediate, where the patient can see. So patient not having pain and also getting the vision restored immediately is something which makes the procedure very patient friendly. So here we have a patient who is being operated in a topical anesthesia, and as we can see, the technique used is phacoemulsification with multiple chops using horizontal chop technique, and whole of this surgery is very well done under topical anesthesia. And we have had few publications also quoting and studying the pain experience of the patient during these procedures, and we have found that it is extremely fruitful and useful for the patient to have the surgery being done under this technique. So this is about a routine practice which is most of us are aware and majority of us are practicing. Then comes this technique which is manual small incision cataract surgery under topical anesthesia. And here I am mentioning one of my publications which is the earliest possible report regarding this surgery being done under topical anesthesia. And it is not so popular still, but this is something which I want that more and more people should adopt to and practice, because it will make a difference in the practice when you are doing small incision cataract surgery for any reason. So the first thing is to remove the mind block that this cannot be managed. One has to be well versed in the technique and use lignocaine 2% jelly along with 1% intracameral lignocaine, which can be a preservative free lignocaine coming as a brand name of Xylocard injection. Don't use any superior rectus suture, it will cause pain. And also avoid using those delivery techniques which use increased intraocular pressure like viscoexpression and irrigating vectors. And the patient's experience are extremely good, and the publication which we had reported had a VAS score of less than 3 in average, as average score among all the patients, and less than 4 is considered very mild pain. Then extending the horizon of use of topical anesthesia, we had performed this study and published it in 2016. Then this is about performing trabeculectomy under topical anesthesia. So if we compare this technique with small incision cataract surgery, we'll find that the tissue which we are handling are just similar. So extrapolating that if the iris, the conjunctiva, the sclera can be treated and handled well without any pain under topical anesthesia, so can be the trabeculectomy also. So the advantages are many, and apart from being patient friendly because it doesn't cause any pain during delivery, there is no IOP rise, there is no acupressure needed, which can be so very important in these patients who are on the verge of losing that central island of vision. And there is no patch needed because few of our patients may be having so much of visual disturbance in the other eye that occluding the only seeing eye which is being operated upon may cause them a lot of handicap even for a while. So this is the post-op picture and the IOP is well controlled. Then extending this application of topical anesthesia further, we have as a proof of concept demonstrated with this study done in 2018, and here we have shown that even pars plana vitrectomy can be done under topical anesthesia, although this is not a pure topical anesthesia because here we are augmenting the topical anesthesia along with intracameral lignocaine. And we have named this Trojan horse anesthesia in a sense that the anesthesia agent is delivered through a corneal incision, and once it comes in contact with the pars plana where the sclerostomy starts to be designed, it anesthetizes that surface also. So apart from anesthetizing the outer surface of the eye, we are also anesthetizing the inner lining, that is pars plana, so that the surgery becomes painless. It increases the safety of anesthesia technique, and the rest of the advantages as the patient experiences are there. But of course there is no post-op advantage for the patient because the retinal diseases don't provide immediate visual gain after the surgery. So the key message here is that topical anesthesia is the best option for your patients. It is safe, it is non-incapacitating, it is time-saving for the surgeon, and it provides a magical experience for the patient who are undergoing vision restoration surgery because the vision gain is immediate after the procedure. So I urge you all that you should incorporate topical anesthesia in your practice, and it may be a turning point for your practice because you will be providing best option for anesthesia for your patient, which will be remembered well by them. Thank you.